Just as the province gets ready to do away with all pandemic restrictions, medical experts say Ontario may be heading toward a sixth wave of COVID-19. There are almost 800 people in hospital with the virus tonight. That is a considerable jump. To put things into perspective, there were 600 hospitalizations reported around 10 days ago. 13 more people were admitted to the ICU overnight, and our test positivity rate jumped to 18% this week, the highest rate since late January. So where are we headed? What do we do about this? And is the Ford government being too hasty in scrapping public health restrictions? Let's bring in Dr. Peter Uni, Scientific Director of Ontario's COVID Science Advisory Table, Rewat Dianandan, Epidemiologist and Associate Professor at the University of Ottawa, and Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital. Good to see all of you. Thanks for being with us. Dr. Uni, experts in Quebec say that province has now entered a sixth wave. Is Ontario heading that way? Are we there? How do we know?
Oh, we're in the middle of it. When you look at our wastewater, it's very clear. You can call it however you want. You know, it's a resurgence of the Omicron wave we had, or a sixth wave. The point is really to understand this is not a BA2 wave. You know, we can't blame the subvariant, you know, that is out there. This is a throw caution to the wind wave. How my colleague Lauren Cipriano actually calls it. She's right with that. The point here really is it's entirely our responsibility what we're seeing, and we just got a little bit too much ahead of ourselves, and here we are, and we just have now a task at hand that's to keep, you know, the slope of the wave upwards relatively flat so that we're not challenged again in our hospitals.
Okay, interesting. Rewat, we just heard Dr. Uni say he thinks we're in the middle of this sixth wave. He also just talked about Ontario's COVID-19 wastewater data. Tell us sort of a troubling story here. How many people do you think actually have the virus tonight? And do you think we're in a sixth wave, in the middle of it?
I have no idea how many people have the virus now, probably because we're not doing testing. Testing is broken. The best data we have comes from things like wastewater testing and sentinel surveillance. Yeah, there's no formal definition of what constitutes a wave. We're in the middle of something, and Dr. Uni is right. It's not driven by BA2. I don't think we've felt the full thrush of BA2's impact yet. What we're experiencing here is the effects of the loosening of restrictions and the fact that we still have a largely susceptible population. So we're in the middle of definitely an increase in cases that is wave-like. So if you want to call it a wave, it's definitely a wave.
Okay, so we can't even blame the variant. That's sort of concerning. Dr. Grill, what's the latest out of your hospital? What are you seeing?
Yeah, so in my family practice office, we're definitely seeing more patients with symptoms than we were, let's say, 2 weeks ago. They're coming into our urgent care clinic, and we see those patients in the evening in our office, and a lot of them obviously are symptomatic. We're also getting more lab tests back than we were getting a couple weeks ago with patients who have COVID. And when I call my patients just to check in and see how they're doing, most of them tell me that they have it and the rest of their household has it. So this virus is spreading quite a bit. I think the other thing that I'm reminding all of my patients about is the fact that we do have assessment centers across Ontario where patients can actually get access to treatments depending on their risk factors. So if you're older than age 70, you know, if you're unvaccinated or undervaccinated, if you're immunocompromised, even if you're pregnant, a lot of those patients that come down with symptoms, they've got to present quickly to their primary care provider or one of the assessment centers because they may be eligible for treatment. And even if it turns out they're not eligible for treatment, they can have a remote monitoring program where they get things to measure their oxygen saturation at home just to make sure they don't get worse. So I'm reminding people about the treatments we have out there. And the last thing is there's a great website called confusedaboutcovid.ca that's been put out by family physicians. A lot of Q&As there, very helpful for patients. Please check it out. It answers a lot of questions if you're confused about what's going on right now with COVID-19.
Okay, that is good to know. Dr. Uni, the province we know is hoping to lift all COVID-19 restrictions by April. And the Premier says, you know, once we say goodbye to these restrictions, they're not coming back. Should we reassess? Is this a good idea? What do you think?
Yeah, it probably won't play out this way. Yeah, we just need to be aware of that. Two things to add quickly. The numbers you asked about, current numbers of infections, wastewater allows us to triangulate that. And we estimate right now that we see daily 30 to 35,000 infections in the province, one thing. And what Dr. Grill has said before, if you really want to make sure that you understand and are uncertain about that, whether you would qualify for treatment and you have symptoms, you can also dial 1866 as a number if you're vulnerable, under-vaccinated or not vaccinated or immunocompromised, as described before. Now, your question, the point really is we need to be aware of that. We're, again, if we're not careful, in the middle of a tidal wave, meaning the force of infection is so much that high-risk settings will be, in the middle of this. It will find its way also into high-risk settings. If we now lift masking, for instance, in congregate settings, etc., this could be very, very challenging. So I would not believe it will happen that way yet. We first need to ride out this wave and hope that the peak is not too high and that we will be below perhaps 2,000 people in the hospital. It could well go up that much. It will be higher than our projections. Why? Because people actually didn't change their behavior moderately, but more than that. And therefore, we first need to write this out before we lift any more restrictions, and strongly recommend to people, again, please mask, please get vaccinated.
Please mask, please get vaccinated. That's been your message all along. Ray Watt,
exactly.
How do you feel about what's to come here? I mean, some of us have ditched masks, and come April, there will be no restrictions in Ontario. That's according to the Ford government. How do you see this playing out?
Well, first, we shouldn't be tying the lifting of restrictions to these arbitrary calendar dates. These should be tied to observable, measurable epidemiological indicators. Second of all, to echo what Dr. Uni just said, I'm concerned about the rate of increase in certain demographics. The rate of climb in cases amongst those over 80 is troubling. We still have a large proportion of people who cannot be vaccinated. Those are kids under 5. We have to do what we can to protect them. So I anticipate, just as night follows day, that a rise in cases will be followed by a rise in hospitalizations and a rise in deaths. Probably less so than we have previously in the pandemic due to the power of vaccination, but unavoidably so. That is a truism. Cases are followed by hospitalizations, followed by deaths. We have to protect our healthcare system. We have to protect the vulnerable. So it's way too early to be lifting restrictions like this. We should keep the easily maintainable restrictions or tools like mask wearing, vaccination, and symptom checks as alive as we can, as long as we can.
Okay. Dr. Grill, from a healthcare standpoint, how ready are we to take on another wave, whatever you want to call this, that we're seeing here in Ontario? We are hearing from the Ministry of Health tonight. It says the latest modeling shows our hospitals and healthcare system can manage any of the projected scenarios put out by the science table. Do you agree with that?
In terms of the modeling, I think Dr. Uni might be better at answering that question. I can tell you that, they try their best to see which direction things are going in terms of the cases. And obviously there's some uncertainty with regards to that. But in terms of whether we're ready to manage it, all I can say is that, my hat goes off to all of the healthcare workers, both in the acute care setting, the community setting, that have worked very hard and tirelessly to serve our communities the best we can. I'm hoping the numbers don't go up to the point where we have to delay more care. I mean, there was an article this week in Canadian Family Physician talking about all of the screening for cancer that was delayed last year and all the catch-up we need. And so the last thing we want to do is to have patients who are not seeking care because they're worried about COVID or they're worried about leaving their homes. And all of a sudden you have a bunch of sick people with COVID. And on top of that, you have people that aren't managing their other healthcare needs that we have to look after. So we're going to continue to do our best with the resources that we have. But in terms of the modeling, I would leave that up to maybe for Dr. Uni to comment on.
Okay, Dr. Uni, I will give you a chance to quickly respond to that. What do you make of what the ministry is saying tonight? It's saying, you know what, we're prepared no matter what comes our way.
I think what is important to understand is, once more, we were not able, because of the change in testing, to calibrate all of our models also for worst case scenarios. So what we've shown in our modeling is just a scenario if there's a moderate increase in transmission, and this corresponds to a moderate change in behavior of people. That's not what we're seeing anymore. We see more than that. People mask less and they have more contacts. Therefore, you can expect that our numbers will be higher than what what we projected, the upper limit. It would go more towards a worst case scenario. And that's important to realize. Most likely we won't see the same numbers as before. We were above 4,000 in the wards, for example, but it could be quite high, and we don't want to interfere with regular care here.
Okay, and I just want to point out to our viewers as well that Dr. Uni thinks there are between 30 to 35,000 COVID-19 infections in the province tonight. That is important. Ray Watt, let's talk about developments in the U.S. The FDA there authorizing fourth doses of Pfizer and Moderna shots for those people older than 50 and older. Is this the right move? Is this something we should try and think about here at home?
It's something we're going to have to think about at some point. I think it's probably a bit too early to implement that here. The power of 3 doses in terms of vaccine efficacy against transmission, infection, hospitalization, death is still pretty strong. Our current challenge is not 4 doses. Our current challenge is getting 3 doses to more people. We have 47% of the nation having been boosted. That's way too low. So I'd like it if we had a full public health push on to encourage greater uptake of that 3rd dose.
Okay, we'll leave it there. Ray Watt Deonandan, Dr. Peter Uni, and Dr. Alan Grill, thank you so much for your time tonight.